1999 was the year our small island of Chuuk had received our first cases of AIDS from abroad. The communication read a semi-conscious AIDS case accompanied by his brother arriving from Guam. The news spread fast and out of control through health services. The patient waited for an hour at the airport. No ambulance driver wanted to pick him up, and family members were too ashamed to greet him. He was brought into hospital on a stretcher. His brother followed him into the emergency room. He had a mask over his mouth. He was in a hospital gown with long sleeves. Because of this, people who saw him thought you could contract HIV through the air and by touching and talking. There was an isolation room, so they decided to put him in the general medical ward in a private room. He was there for a month or two, waiting for the private boats to go back to his home in the outer islands of Chuuk. Nurses called in sick just to avoid caring for him. They would pass his food and medicines under a curtain. There was so much fear. The patient was not aware of his surrounding. It was the brother who received all the shame and got mad sometimes at the discrimination. At that time, I had no expertise about HIV/AIDS, but I was asked by my director to help out. I was just as afraid as everyone else. I finally thought if everyone else is afraid of the disease, who could be there for the patient and the brother? I had committed to try my best as I can, with the little knowledge and understanding, and that commitment becomes my passion until now. After 1 or 2 months, they finally got onto the boat and went back to their little island. The stigma followed them. Years have passed since then, and after being trained, I am not afraid of handling AIDS cases. I provided education awareness to the community to respond more positively to AIDS cases and families, and to prevent the virus from spreading.